You know, today a patient just asked me about how friendly we are here. Everyone is friendly, and he asked me if we received any monetary benefit for that. And we were down in X-ray, and I said no. And the X-ray tech just piped up and said, but you know what, we do get a very good benefit. We work with good people. It's enjoyable to come to work, and the patient was just impressed at the culture that they have built here that is so friendly and patient-centered.
Sometimes they come in not knowing if they're going to make it home, and this might be their last stop, but we help them get the courage to keep going and fight through it, and eventually they get to where they need to be.
You have to have that compassion. You have to have patience and understanding. And know that, you know, if a patient is having a bad day, it's not them. They don't feel well, you know? And you just try to find something within your day that you're doing to make their day better. You know, smiling, just coming into the room and just giving eye contact with a smile. Even that, you know, sometimes brightens up their day.
We commit to providing patients and families extraordinary care for every generation. So on top of providing stellar medical care, we provide care that is very relationship-based, and clearly what separates us here at Covenant is the culture of people that we have working here. You can only provide wonderful things to patients and families when you have people who work with you who are committed to that means, who are in and of themselves extraordinary. They dedicate their time, their talents, and their wisdom to patients and families in this community. And the culture that is here at Covenant is untouched in any other arena you will ever be able to find in any hospital anywhere.
Beth Charlton, she's the CNO here. I think she had just got the position. She was walking by and she saw that I was struggling with the patient. So she actually came in, put gloves on, and helped me turn the patient, which was amazing.
What we pride ourselves on is our awesome teamwork. I mean, we work really hard every day, but we are challenged by our patients. We get a lot of positive feedback from them for the work we do. We have fun together.
When they see, when the employees are having a good time at work, or when they enjoy their work, the patient care has got to be better.
I like Covenant. I really like the laid-back and relaxed environment. I like all the teamwork that we have around here, and it's thoroughly enjoyable, all the smiling faces in the morning, so.
I started here 35 years ago, and I just kind of fell in love with the place. I started out as a phlebotomist here when I was 18 years old, and I've grown all the way through, went to nursing school. And it's always just a warm, friendly environment. At the time it was St. Luke's and Saginaw General, and I was here for the merger. And it's always just been a warm, friendly place, and my whole career is here. My wife works here as a medical technologist, and my daughter worked here as a med tech, and they both volunteered, so it's a whole family affair.
When I was a young kid, I was always helped my mother take care of people, so therefore I knew my passion was to help others.
My mom's a nurse, my sister, my aunts, so yeah, I kind of grew up knowing I was going to be a nurse, so.
Ever since I was a little girl and taking care of my grandmother, I wanted to be a nurse. We had home health aides that came in the house, which were actually was VNA, and they allowed me to help with them with little things, and so it just grew. And always just wanted to care for people, and I tried for a long time to get in here.
I found out I wanted to be a nurse fairly young. I had to have a surgery when I was younger. I went to Detroit Children's Hospital, and so I had a gentleman that took care of me who was really great, and I decided then that I wanted to be a nurse.
After I had my daughter, I really enjoyed my nurse, and I didn't think I could do it, but it was something that I love taking care of people. I love helping people and being there for them, and you know, people need that, so I do enjoy it.
I'm a natural caretaker. I take care of all my family members. I just love caring for people, and babies are just, I mean, they're the most vulnerable population, so when you can take care of them and their families, there's nothing else better.
It's pretty amazing to watch them grow daily, because they actually do. And yes, of course, it's the little ones, their vulnerability, knowing that you are their defense, their offense. You're here to make sure that they grow and aspire and then get home as soon as they can.
It's not for everybody. I think you really have to have a heart, you really have to have compassion and want to be a caring person and spend the time with a patient to be an OB nurse.
OB is a whole different ball game. it's a birthday every day. We absolutely have our great days, and along with great days, we have bad days. But that's when you really feel that family coming out, because we back each other up and we're there. When you walk on our floor, you're always going to be seeing somebody giving somebody a hug and telling them, you know, we're getting through this, we're doing okay, and we make it through.
I've always just really loved making sure that people are taken care of and really interacting with people, and medicine is just so extraordinary to me. I've only been here a year and a half, and I can't say how much I've learned and how much I'm still learning.
I got into nursing because I have a huge heart where I just want to care for people and make them feel better and help them get through what they're going through.
I help them through problems if they need help, advice, and we work together as a team and pull through the hard times, and there's lots of good times that go along with it, so always remembering those. And in the end, we're helping the patient and their families through the rough times, and that's what's the most exciting part of the job.
Very fast-paced. We have a lot of admissions and discharges. We can get up to 10 discharges a day, 10 admissions a day, lots of surgeries, even throughout the night, into the night sometimes, so very busy.
I always call us, we're controlled chaos and not total chaos, because we get a little bit longer length of stay with the time, and we get to know them, and that is all a part of that whole picture that we work with them, and it's not just their physical needs, but their emotional and mental needs as well.
It's a tough job. We see a lot of terrifying things, but yet their compassion and caring is what makes us the best.
I think the staff that are here are dedicated healthcare professionals who truly care about the patient and the nursing career.
I just think Covenant's a great place to work. I've been here for over 30 years, and I hope to continue to stay until I retire.
I had a special connection with this unit because my father was here for a while, and I saw the passion and the care here, and I knew that I wanted to be part of this team. So here I am.
The ER, I wouldn't be here for as long as I have been if it wasn't an amazing place to work.
I think I like the ER because you can come in contact with so many different patients in one day, and you really feel like they come in so sad and sick, and during the course of their treatment, you see them get better, and you can do that all over again within a half hour or even 10 minutes sometimes. And so you touch so many lives within one day that you really feel like you're doing such a great good that when you leave at the end of the night, you feel better about yourself and you feel better about your job. It really gives you a meaning to life.
Well, I actually was from a very small community about an hour away, and I knew that when I wanted to be a nurse, I wanted to have an opportunity to work in a hospital that was large enough to be able to take me from the beginning of my career to my end. And to be honest, Covenant gave me that. The minute I walked in the door.
I have been here for 33 years now. It's just such a warm, caring atmosphere. You know, people care about each other, they care about their patients.
It's wonderful to see the kids. They stay much, or they go home and they get well and go home much quicker. So it is rewarding when you see somebody come in really, really sick in a few days. They're walking in the halls and doing much better and go home much quicker than the adults do.
I love the birth center. I've worked here for 20 years, grew up in this place. It is one of the most wonderful places to provide care for women and children. We are baby friendly. Everything is geared towards providing extraordinary care to women and newborns, and it's just a fabulous place to work.
Because you're part of somebody's journey. It's a very vulnerable time in a woman's life as well as her family, both for good times, and we do have bad times, so you can be there to support the mom when she's having the most wonderful experience of her life, but she could also be having the most heartbreaking experience of her life in losing a baby.
You know, I've worked at a couple different facilities where, not facility bashing at all, but where maybe there isn't like the organization and the structure, the support. And so that's much different for Covenant. We have that.
There's always something different. We get to see a lot of different patients coming in, a lot of different medical problems. And then just our teamwork on the floor here, it's really great. We have a lot of really good people that work here.
I think it's a family knit place, and that's what I like. You don't see that at a lot of other places. They just take care of each other, and it's just different. It's just like one big family. So that's what keeps me here.
Everybody feels like their family. Everybody can count on their team. Everybody likes their job. I mean, even patients will say, well, everybody's so nice. And it's like, yeah, we don't want people here that don't want to be here. We want everybody to enjoy what they're doing.
I think Covenant's probably special because we're very much like a family. Even though we're one of the bigger hospitals, we still maintain more of a family type atmosphere. And that's important to me.
Hands down, it's a very rewarding career.
It is the culture. I mean, just at Covenant in general, it's the culture. On 2 Main, it's the culture, the teamwork. The coordinators that I work with, we all support each other so much, and it's just, I love coming to work every day.
Covenant's the place to be. We're an amazing place. We're always trying to do better, not only for our patients, but for the community and for our staff, and it's where you want to go.